Go.
Okay, so this is the pelvic girdle. This is one of the bones you're going to have to decipher right and left. First of all, you need to kind of start out what's front and back. All right. Let me grab my utensil. This right here, you guys see that like little, that thing right there? Mm-hmm. All right, that's your greater sciatic notch. That is always going to be in the back. Okay, so that, how do you like a upside down U, whatever you want to say, that's going to be in the back. So looks like a 7. Okay, 7. That's going to be in the back. This guy here, this big crater, all right, is called your acetabellum. That's always going to be on the lateral side. Okay, so if this is in the back and that's on the lateral side, this is going to be your right pelvic bone. All right, so that's kind of how you decipher right and left. Look at these two landmarks: acetabellum on the outside and the greater sciatic notches in the back. Okay. Now there's 3 main regions of the bone, and they sell a colored bone, but it's too expensive. So let's focus in on this lab manual, if you could. Okay. This just top portion of the bone is referred to your ilium. On the test, I would say name this bone. All right. The front portion is your pubis. And then you can see the greater sciatic notch right there, so you know that's the back portion. This back portion is your ischium. So all 3 of those are bones of the pelvic girdle. All right, those are the 3 regions, and I like this because it's color coded. All right, so the top is the ilium, the front is the pubis, and then the back is the ischium. All right, so I don't have a sheet in front of me, so I'm going to do the best I can. Now keep your sheets. All right, so this portion right here, like like the moon, is called your iliac crest. All right, that's your iliac crest. Now, if you ever see like a real skinny person, you can see like the bones or hip bones hanging out. That would be this one right here. All right, you've got one here and then one here. So these 2 areas that kind of come out, they're in the front. Okay, they're in the front, and one's on top and one's on the bottom. Okay, so this is going to be your anterior superior iliac spine. The one right there is your anterior inferior iliac spine. So you have 4 iliac spines. 1, 2, and then when you turn over the crest here, 3, 4. So just name it. So iliac spine, iliac spine, iliac spine, iliac spine. So then you just name it directionally. So anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. Tongue twister. And then how do you know this is the posterior? Because your greater sciatic notch. Okay, your greater sciatic notch. All right. So let me just make sure I get all these. Acetabellum. We did talk about the acetabellum. That's right here. That is going to have a ligament that attaches, and this is where the head of the femur goes right into the acetabellum, right like this. All right, just like this. Okay. So let's look at the back. So I'm going to turn this around, look at the back. This is my greater sciatic notch. Okay, making sure. This right here is my ischial spine. Ischial spine. So greater sciatic notch, ischial spine, lesser sciatic notch. And the sciatic nerve runs right through there. It's in the back. That's why you would have back pain or lower leg pain. So greater sciatic notch, ischial spine, lesser sciatic notch. This rough patch in the back, where muscle attachment is that's called your ischial tuberosity. A lot of muscles go in here, wind in here, nerves as well. That's called your obturator foramen. Obturator foramen. Okay. Now, you need a model like this to see this one. This is your sacrum. This is your ilium. So this line right here, see that line that runs right there? That's called your sacroiliac joint. It's the joint between the sacrum and the ilium. So that line right there, and then that line right there. And then the cartilage that fuses the two pubic bones together is called your pubic symphysis. Okay, actually not bad. The four iliac spines, it's like tongue twisters, but that's not, once you kind of sort that out, everything else is, I think, pretty simple on this. I think that's it, right? Did I miss anything? Ischial tuberosity, I did that. Ischial tuberosity. Ischial tuberosity is the bumpy part in the back. Yeah. Okay, thank you.